So in Kentucky, we have 3 different programs. So we have the direct billing program, and each school district gets the opportunity to decide who they'd like to have a contract with. So that is up to your school district and who they choose to be their provider for this. In majority of our districts, Info Handler has the direct billing program, and that is an electronic health record system that basically tracks what the provider's providing to the student. They're entering it into their system, and then they execute it to be billed and bring back money in. We also have PCG. PCG has one of our biggest districts, and PCG is also our administrative claiming provider. So if you don't have PCG in your current district, you will be working with PCG because in order to be part of the direct billing program, you have to participate in the administrative claiming program. And then the last group we have is Civic Solutions Group. And then for administrative claiming, like I mentioned earlier, our vendor is Public Consulting Group, and they run the random moment time study. So each district that participates in this program participates in the administrative claiming program. And lastly, our cost reporting, cost settlement vendor is Fairbanks, and they manage to, at the end of each year, to basically review your direct billing and administrative claiming and do the checks and balances and make sure that you were paid out adequately for those parts of the program. So you will be working with all of these vendors and the administrative claiming and the cost reporting, but you most likely will have only one vendor from the direct billing. So you will get to know those vendors, especially as finance officers. You will be getting checks and paying out these vendors as well. So let's go ahead and deep dive into the 3 programs that make up the school-based Medicaid program. So in order to be a part of one of these, the whole program, you have to participate in all 3. So the most commonly understood part of the program is the school-based health service program. This is the program where your district provides a service to a student, and the student receives the service. This is most of the time listed in the IEP. If you're a part of expanded access, you may just provide a service from that, but we'll delve into that a little bit more. But this is where you have a provider in your school district providing a service such as speech to a student. They give the student the service. The service is then entered into the electronic health record system, and your district is able to bill for it and get a little bit of money back. And then the second part of this program is the school-based administrative claiming program. This is our vendor, PCG, runs this part of the program. It's a random moment time study. So districts get emails and to the providers that are listed in this study, and they let you know what were they doing in that little time of moment. And if it was a billable moment, then they will respond to the message and you'll get to claim for the moments that are the administrative duties. So the first part of the program is for the services, and this is capturing the background work that goes into it. So this is capturing planning, meeting with the ARC, things of that nature. And then lastly, the cost reporting, cost settlement. So this is, like I said, the checks and balances to make sure you received enough money from the first 2 parts of the program. So this happens at the end of the year. And what this really does is they look to make sure you got enough for the services that were provided. You bill, like for the administrative claiming, they review and make sure that those people were listed on the correct lists. And then if you weren't paid enough, they will write a payment. They will make sure that the Department of Medicaid writes a check to the school district to make sure that we're equaled out and we received enough money. Oftentimes, this is where we find errors in funding sources, such as federal funds being used to pay the staff, but we'll delve more into that. But these are the 3 parts of the program that make up the school-based Medicaid program. So we're first here's just kind of a breakdown. In order to make the school-based Medicaid program, you have to have all 3 pieces. So this is just kind of a chart reviewing that. And now we're going to delve in to talk about the direct service, the fee-for-service program. And so what this program offers to our school districts is our school districts already have IEPs in place. And in order to be able to provide our students with the best services and make sure that they're, getting the money out of this program, we want to make sure you understand what this program entails. So the goal of this program is to help support the services that were already mandated to serve these students. And so for IEPs, that is a legal binding document. By having speech in there, our school districts have to provide speech if it's listed in the IEP. This program says if those speech providers are not paid by federal funds, then we can actually bill those services to get money back from the federal dollars in this program. So this is for those hands-on services such as OT, nursing services, physical therapy services such as with that nature. So it's direct services going to those students. So in this program, it's a 70-30 match. So if you have a provider that's paid 100% from general funds and they provide a 30-minute session to a student that has an IEP with this listed in it, then you can bill for that, and you should get, based upon the rate that it costs this provider, you should get 70% back of what it would cost that provider to provide that student that service. So the requirements to build this program, there are several requirements that must be met before being able to build this program. And the child these are the main requirements. So if you don't hit one of these, then most likely you can't bill it. But we'll talk about the caveats in this program too. So the basic requirements to bill is the student must qualify for Medicaid. And the school district's not responsible for determining this. Every vendor, your direct billing vendor, determines that in their system. Their computer runs a background check every few days to make sure those students are Medicaid eligible. If you're billing IEP Medicaid, then they must have an IEP with the service listed in the IEP. If the child deems that it's medically necessary, and that means that they don't have an IEP, and you guys participate, your school district participates in expanded access, which is another part of the school-based Medicaid program. That means the student doesn't have to have an IEP, but if it's a student that receives nursing services, let's just say a student that has diabetes that does not qualify for an IEP, but they need their insulin checked periodically throughout the day, and nurses deem that it's medically necessary, the student receives these services, then you can bill that in your direct billing system as well. Your practitioner cannot be paid 100% from federal funds. So if you pay his practitioner 50% federal funds and 50% general funds, then you could still bill for Medicaid. And then a child must have a parental consent. This is for IEP students and expanded access students. If there's no parental consent signed on the student, then we are not allowed to bill for those services for that student. So it's imperative that your district has a parental consent signed prior to billing for any services. A lot of our school districts now put this in their enrollment paperwork that's electronically done. So a lot of students get those parental consents done in that manner, and that is completely acceptable as long as the parent has signed it. If you're billing for expanded access, the service must be available to all students. And what we mean by that is you're not going to determine a student doesn't get nursing services because they're not Medicaid eligible, and you're not going to provide it for those students, but you would have to provide it to all students, which I don't know a school district that wouldn't provide a service to all students if it's medically necessary. So we've been talking a lot about IEP versus expanded access. This kind of breaks it down. So expanded access is where we can provide a service for a student without an IEP. So that means there's no IEP that has the service listed in it. The service is listed to all students in the school, just as we talked about, at no cost for the student. It must be deemed medically necessary, and that is not by a physician or anything. That's by the provider who is providing the service. So that could be a mental health provider, that could be a nurse, that could be an occupational therapist. So any provider within the school can determine if it's medically necessary. And this is usually paid out at about a 50-50 rate. So expanded access, they say that it is similar to the IEP services, but it's kind of hard to figure that out. So some people say that they get about 70-30 back from expanded access, while others say they don't see as big of a gain, but it's still money back in our pocket. So this is expanded access is not enough to like hire additional staff that you're going to get back. No money in this program is going to be able to open enough money to hire additional staff, but it helps supplement those costs that we already have to pay in our school districts for these staff. So this is not this program does not mean if you're just starting it that you can hire a bunch of new staff and a bunch of new providers. It means we can help fulfill the payments of the providers that we have on staff. And so the IEP part of this program, this is where the service must be listed in the IEP. So if you have a student with an IEP and they're receiving speech services, and in the IEP it says they're getting occupational therapy and PT, but not speech, then they can't be billed into the IEP program. It must be listed exactly as it is provided in the IEP to get that service covered under the school-based Medicaid program. And it must be provided in accordance. And when we say that, we mean if it says a student is seen 20 minutes, 2 times a week, you cannot do 40 minutes 1 time a week. It has to be provided exactly as it is written. If it is listed in the IEP, that deems the medical necessity. So even though it says it must be medically necessary, the IEP deems that medical necessity. And this is paid out at a 70-30, as we've already talked about. So whatever it costs for that 20-minute session, you're going to get about 20 or 70% paid back, and you all will cover the 30%. So we talked a little bit about parental consent and how a lot of districts are now getting parental consent in their enrollment. Parental consent is obtained 1 time as long as the student is continuously enrolled in the school district. So what that means is if a student is removed from the district because they went to live in the county next to you or with dad in the county next to you or the independent school in your district or in your county, then you would have to get a new parental consent signed. And if the guardianship changes in, like the parent is no longer the guardian and the state takes over the guardianship and they go to a foster home, you will need to get a new parental consent signed. If you don't get an parental consent signed annually, you will have to send home an annual notification. This is just a letter letting the parent or guardian know that they are billing, your district is billing for school-based Medicaid. If you are providing a service to a student, the parental consent cannot be signed after that service or you can't bill for it. So say you have a student that is enrolled into your school district on August 1st. The parents didn't sign it in the enrollment paperwork, but you guys are already providing that service the first week of school and you have not gotten the parental consent back. You will still need to provide that service, but until that parental consent is signed and returned to the school, you cannot bill for those services. As soon as that parental consent is signed, though, you can start billing, but there's no back billing with a parental consent. It can only be billed from the sign date forward. And then if a parental consent is denied by a parent, you may not bill for that student for any Medicaid services. You can still provide services for that student, but it cannot be billed. And we do have those situations where parents do not feel comfortable signing the parental consent. We always offer that you can reach out to KDE and we will be happy to connect with those parents and explain what this parental consent is saying. Oftentimes parents are concerned that they are going to have to pay for these services if they're provided at the school, and that is not true. It does not impede any of the services that the student is receiving. So if a student receives speech at school that day, the student can receive private speech outside of school with their traditional Medicaid. It does not overlap with traditional Medicaid because this is school-based Medicaid and it's billed under a different code. So that sometimes is a barrier, but that's good to know that, we're always here to help facilitate any issues that a school district runs upon with parents. So these are the covered services under the school-based Medicaid program, and that is nursing, audiology, speech language pathology, occupational therapy, physical therapy, mental health therapy. So mental health therapy has multiple therapists that can bill under it. This can be social workers, actual doctor therapists, but we do have a list on our website where you can reference that. It's really important that if you're hiring somebody intending to bill for under school-based Medicaid, that you make sure that they qualify under our mental health therapy guidelines before you hire that person, because some licenses are not approved, but majority of them are. We even have marriage counselors and art therapy listed as a provider, but you definitely want to double check before hiring somebody if you are going to bill it under this program. Incidental interpreters are eligible for billing only under the IEP part of the program. Assistive technology, these are devices that students use in schools, such as wheelchairs, iPads, things of that nature can be billed, but that it only falls under the IEP portion of the school-based Medicaid program. They must have an IEP and it must be listed in the IEP in order to be able to bill assistive technology and incidental interpreters. Additionally to that, transportation is eligible for billing under IEP, and that is for bus rides to and from school on days that students receive services. And then orientation and mobility is also eligible, but that has to be listed in the student's IEP as well. So here are some components to the school-based Medicaid billing. This is for direct billing still. When we provide therapy to students, there are two types of therapy that are eligible to be billed under this program, and that is individual therapy. That is an automatic default in this program, is a face-to-face, one-on-one therapy. So if a student has this listed in their IEP that they're going to receive speech therapy and it is not specified that it is group therapy, then it automatically defaults to individual therapy. Group therapy is allowed for specific providers. That is for speech, occupational therapy, and physical therapy, and mental health therapy. That is not allowable for nursing services. But in order to be able to bill group, it has to be listed in the student's IEP, and the group cannot be more than 6 students. When billing group therapy, it is under a different code because it is prorated essentially because there may be multiple students receiving the service at that time, so it may come in at a different rate. But it must be listed in the IEP or it automatically defaults to individual therapy. This is something we often find in our audits, that they did not list groups. So that is something to be very cognizant of when you're reviewing IEPs for your district or billing group therapy for any of your providers. This is a component that we oftentimes see that school districts forget is a billable service, but this is something that could bring in a lot of money into school districts. So as finance officers, we thought you might find this, interesting as something to definitely highlight in your school district to bring additional money from this program. So evaluations are mandated in providing IEPs. Every provider that writes an IEP has to have an evaluation. So speech, OT, provide evaluations. So the assessments testing and the actual writing of the report are eligible for billing under this program. This this can be done in multiple days, but it can be done, like, let's say you're doing an evaluation on a student and they test the student on Monday, and then they evaluate in the classroom on Wednesday, and then they actually write the report on Friday. You can bill all three of those sections under this program, and it just has to be billed exactly as it was provided. So you would need to bill all 3 days. But this is something that people forget about because writing these assessments take time, and testing these students. So if you have a student that comes in and the ARC decides that they want to test the student and do an evaluation for occupational therapy, speech, and physical therapy, then you can bill all three evaluations as long as the student qualifies for one service. So if they only qualified for speech, you can still bill for the testing, the testing, the evaluating, and writing of the report for all three of those evaluations. So this is something that is definitely missed out on oftentimes from the school district, but this is something we thought we'd bring to the attention of you all, so you understood that that is something that can be billed for. So we talked about assistive technology a little bit and how it can be billed, but it has to be listed in the IEP. So assistive technology can add up because you may be buying a wheelchair that costs $10,000 that is required for this student. So this program can help with that. Assistive technology, it must be listed in the IEP, and it requires an evaluation. So if you were to purchase this specific wheelchair, let's just say, and that would be an evaluation from a physical therapist, most likely, that would require that it's listed in their evaluation. And then it would need to be listed, the model, the type, everything exactly as required in the IEP. Then you would bill it. You cannot purchase the equipment until it is listed in the IEP. So if the IEP is written let's say December 10th, and you purchased it December 9th, then that would not be eligible for billing. So you definitely want to consider that before purchasing something. So if you have a big purchase, but this will help pay for 70% of the device, which is significant if it's an expensive item. Now, there is a caveat to billing assistive technology because it's listed in the student's IEP. That means it is required that the student has that piece of technology in order to be legally compliant with the IEP. But if the student takes this technology home, they are eligible to, because this device is actually the property of the students. Even though it's billed under the school-based Medicaid program, because it's billed under their Medicaid ID, it is their property. So the parent is eligible to take this home. And if they don't return it, then you guys are in kind of a bad situation. So that is something to consider. You have to be selective of who you feel would be best fit to have assistive technology. So if it's a family you know well and you trust that they're going to return that device because they want the best for their student, then definitely bill it under assistive technology. Assistive technology is only eligible for use for that one specific student unless the student donates it to the school. So say the student outgrows that wheelchair, they can donate it. The parent can write a letter and donate it to the school when that student outgrows it. We have a lot of problems just with most commonly, our biggest issues are iPads that students that purchase under assistive technology. They take it home. Mom and dad don't send it back, and it's written in the IEP, so the school then has to buy another iPad to make sure that they're following the requirements of the IEP. So that's our biggest device that we have issues with, but this is very beneficial if you are buying an expensive a piece of equipment. So this is something to consider if you have a student that is medically fragile. So another part of this program that is really beneficial and helpful is transportation. So transportation can be billed only for students that have an IEP. This part of the program also has several requirements in order to be able to bill it. The student must receive a service the day that they are receiving the transportation. Transportation kind of doubles up in helping, so you bill it directly, and then you kind of get a kickback in the cost settlement. And we'll talk a little bit more about that later. But transportation can be huge to school districts, especially those districts that drive several miles a day. So in order to be able to receive this, the student must have transportation listed specifically in their IEP. The transportation has to be on a special transportation bus. And so that's a special ed bus. And that means there must be a specific device on the bus that makes it special. So that can be a harness, a lift. So those are requirements in order to build special transportation. We encourage no general population students on these buses, because if you have general population students on these buses, these have to be prorated. So that means, and I'll show you a breakdown of prorating in just a second, but if you have a student riding the bus to and from school on a day that they receive service, you can bill from the date or from the address of the home to the school, and then on the way home to the school to their address. It doesn't include like the stops, but you have to use like Google Maps, and that is the determination of the mileage that you can bill for. So if you have a student that lives 15 miles away from school, that's 30 miles you can bill daily, which is really helpful to school districts. Now, we talked about how this with prorating, this can be problematic. So oftentimes we have students that have a brother or sister and they don't want to have two buses driving to their school, but this is why this is discouraged in this part of the program. So say your district has 3 students riding a T5 bus, and one student has an IEP and received a medical service that day, and they are riding and they're eligible for billing. But 2 of those students are general population students. Say the mileage is 5 miles one way. The student rides it to and from school, so that's 10 miles total. But because there were 2 general population students on the bus, you have to divide that by 3. So then you divide it by 3, and that rounds it down. So as you can see, that decreases the money that your school district's eligible for billing. So that's why you may have, your special ed director encouraging you not to put general population students on a T5 bus. Oftentimes it's because it discounts how much money they're getting back from the school-based Medicaid program. So this is just from direct billing in the 23-24 school year and the 22-23 school year. So this is just the direct billing part of the program, and that is not this is significant, but not as significant as it is in the cost settlement. So this is what we got back for state overall for billing transportation. So those numbers look like, that's a lot of money, but when you think about districts, that's not that much money. But what we really focus on is we get this money back, and then when you get to cost settle, you get to claim depreciation of your buses. So that's a huge win. So billing direct services is very beneficial, because in your cost settlement, if you bill direct services, you get to claim depreciation of your buses, which is very significant. And if you have newer buses, it's very helpful and you get a significant amount of money back. But we'll talk a little bit more about that later. So on the next few slides, I just threw these in here to understand. We talked a little bit about how it's important before you hire somebody in your district to know what license they have if they're going to bill school-based Medicaid. So the reason we focus on that because this program requires a few different things than what are required just for school standards. So to be able to bill school-based Medicaid, a very common one that we run into is speech language pathologists. So speech language pathologists have to have a Kentucky license in speech therapy. So you have to have that Kentucky license, which that's not, that's not uncommon to have. However, they also have to hold an ASHA certification. And if they're a new college graduate, they don't hold that. Now, recently, in the past couple of years, we have allowed for students to have the time that they need to be able to get their ASHA so they're able to bill. But say you have a specific kind of social worker, they're not going to be able to bill unless they're master level. So there's really big things that you need to look at before hiring staff to make sure that you're going to be able to bill for them if you're planning on billing for them for this part of the program. That's not for everybody, but if they're going to fall in the special ed program and you're anticipating being able to claim that money back on them, make sure they align with our practitioner qualifications and modifiers. So this is a full list right here, but there is a reference at the end of our program that you'll be able to click on. There's a link that you'll be able to pull it up in our technical assistance guide and reference that. So now we're going to move on to our administrative claiming program. This is something that you as a finance officer will work often with. This is our random moment time study, and this is taking into account all the administrative duties that are done in the background. So not the direct services, but the things that are going on in the background of this program. So you as a finance officer will have an account with Public Consulting Group to be able to log into our system because you will review the finances every quarter to ensure that we are claiming your district's claiming accurately how much it costs to hire the specific people that are on these lists and take into account their health insurance and all the fringe that goes along with that. So you will be reviewing this every quarter for our administrative claiming program. So this is the administrative claiming program, and this is what we're claiming from this is we're claiming the activities of outreach that supports the school-based Medicaid program, like activities such as planning, trainings, ARC meetings, things of that nature that go into supporting the direct services. That's what we're catching. That's what we're getting money back for in this program. And this is the 50-50 match. So we're getting 50%. Our last program was 70-30, but this program's 50-50. But in order to be able to participate in direct services, you must participate in administrative claiming, and that is a CMS guideline. So you can't just pick and choose in this program. You must participate in this program to be able to direct bill. So this, like I talked about, the allowable activities are training. So oftentimes we can claim in the administrative claiming, we can claim trainings that we send our staff to. So any kind of speech trainings, OT trainings, special ed trainings, these can be claimed in this part of the program. Coordinating meetings with students and between a provider and a parent. These things are what we're capturing in the administrative claiming program. This, like I said, the point of this program is to capture the administrative tasks related to the medical services that we provided in the direct services. We also, this is just a list right here. We also want you to understand that this part of the program, how we're capturing this stuff is that random moment time study that we talked about. So I'm going to show you on the next slide a list of the staff that will be getting those random moments to capture how we're getting these how we're determining what was going on in those moments and determining if they were billable in this program. So this is our staff pool. So each director of special ed or their assistant are filling out these lists of our staff pool lists. So we have administrative personnel that are listed, and these are people that are performing activities like it could be a teacher, it could be a secretary, it could be the director of special ed that are on these administrative duty lists. And then we have the direct service list. And these are the people that are providing those direct services. So this will be like your nurses that you're billing for, your speech therapists, they would be on the direct service list. And we have a breakdown of these lists in our SBAC guide, and that's also a link that I've referenced in the back, but that's where we put these. We have 2 cost pools in Kentucky, and that's where these random moments are determined from. Each cost pool gets a pool, like it's like the lottery. Your name may get pulled off your cost pool list, and they're gonna send you an email and say, what were you doing in this moment? And that's where we're gonna reference, was it one of these purposes of the SBAC program? Is it something we can claim as a billable service? So these 2 staff pool lists these are the personnel that you're going to be pulling and making sure that their finances are listed in PCG system. Now, for these staff pool lists, these amounts of money that you're entering, very important thing to focus on is that these are not all federal fund dollars. So if you have somebody that you are paying 80% federal funds or 100% federal funds, you're going to want to double check with your director of special ed. What's really hard in this program is making sure that the finance officer and the director of special ed who runs this program are communicating and making sure that the people on these lists are not paid 100% federally funded. This is a huge finding in our cost settlement. Oftentimes when school districts owe money in the cost settlement, it's because they were listed in the administrative claiming staff pool list, but they were paid from federal funds. So that is why it's really important you guys work together when you're working on this part of the program. But you will be entering in the money for these 2 staff pool lists. So this is the administrative list. These are just some examples of who you might find on the administrative list. Like it says right here, a licensed speech language therapy assistant. This is not a speech language pathologist. So because they don't have that credentialing, they would be listed on the administrative cost pool list. And that's kind of like what we were talking about a minute ago. It's really important to know who you're hiring and what their license aligns with to make sure that they can be put on the direct. And in this case, if they're not, then they can be administrative claiming. So it's not a full wash. You're still being able to claim those people's salaries, but you may be getting more money from them being on the direct service list. School counselors, school psychologists, psychological interns, family resource coordinators. These are the people that you would see on the administrative cost pool list. And then here's the direct service list. Like I said, this is an ASHA certified speech language pathologist, a health aide that's billing. These are people that are going to be on your direct billing, but they are not doing just administrative duties in the background. So now this will be where we talk about the cost reporting, cost settlement. So this occurs 1 time a year. So this is reviewing what your direct billing is and what your administrative claiming is. This is your checks and balances. This is making sure you were paid correctly and you didn't include those federal dollars. Those people paid 100% federally funded. They're checking all those things in the background. So every year, 1 time a year, your district will do the cost reporting, cost settlement. And this is your director of special ed and you as the finance officer will go to a training. And this training is provided by Fairbanks. You will work on this together. You will submit it. And then you're done and you just wait for your cost settlement. And Fairbanks goes through and audits whatever they've pulled for your district and make sure that the people that they're reviewing, were not paid typically federally funded, or those people were not listed on your annual direct service application. They're making sure you've checked all the boxes to make sure that you have billed this correctly. And they're making sure that you all got enough money back. A lot of times we underclaim when we direct bill. And so they're saying, oh no, they should have gotten $30 for that 30-minute service, but they only got $20. So they're going to add that $10 back. Oftentimes, this is where a lot of money comes in for school districts. And like I said, this is where we get a lot of money back for our transportation. So we decided to become a cost settlement state in 2008 and 2009. So this is when we decided to implement this program. This is when our program became really successful, because before then we were having struggles with the Department of Medicaid and the Department of Education billing this program accurately. So adding this piece of the puzzle has been very beneficial and made us bill this program more accurately. So like I said, this is a one-time-a-year report, and you and your director of special ed will work together to file this, and you will file this with Fairbanks. Fairbanks is a vendor of the Department of Medicaid Services. So this program actually falls under the Department of Medicaid. So the cost reporting cost settlement is done by the Department of Medicaid, but the SBAC program is done through the Department of Education. So we're kind of working on this program all together with two agencies working together. Just something to kind of understand. So the cost settlement and transportation, this is what we talked about earlier. These are some huge benefits. In the cost settlement, we get to account for the bus driver's salaries and benefits. We get to account for the repairs of our buses, fuel. If we rent our buses, these are things we can claim on our cost settlement. And a huge thing that I keep focusing on is that depreciation of our buses. So these, we are direct billing for these, and we're getting about a little over $1 a mile in direct services for our transportation. And we looked at those numbers. We got $720,000 for the state a few years ago, or for 2 years ago, and 3 years ago we got $920,000. But that wasn't really the big winner of our transportation, because in our cost settlement, we get to claim all these things as long as they're not federally funded. So this is very beneficial to your all school district's finances, is claiming transportation in this program. So here's a little review of our reimbursements. This is just a generalized overall state payment. This is not specific to any district specifically, but you can see in the blue, this is our direct services. So we got about $8.5 million from this program for direct services. So these payments come every 6 weeks or so for each district. So this is not like a huge lump of money that's coming to you, but you're getting it every 6 weeks. So it's kind of, it supports your district getting, money in every 6 weeks or so. And then the orange, this is your SBAC program. You're getting these payments quarterly. So you're getting these payments 4 times a year. So this is something you can anticipate getting every quarter. And then, as you can see, this is about $6.25 million. And this is your cost settlement. This comes one time a year. So you only get this payment one time a year, but it's a very large lump sum that you typically get out of this payment. So this is kind of just an overall view. It depends on how, this is very dependent on what your FMAP is in your district, how aggressively your district bills school-based Medicaid, what you bill for. So this is not, specifically showing you how much you're going to get, but the more invested you are into billing this program, the more money your district will receive. So this is the role of the Department of Education in this program. The Department of Education monitors 1/3 of districts annually. So this could be a desk review. And so you have the Department of Education reviewing. Then there's something called a perm audit that may happen. That's where where CMS is reviewing just one moment. And then your cost settlement happens annually. So people are reviewing this program throughout the year, and it's not a big deal. This is not to catch you doing anything wrong. This is just to make sure everybody's following CMS's guidelines. Our top 5 districts get monitored annually. Most substantial findings in any review that happens in this program is claiming federal funds. So like I said, communication is just so imperative between finance officers and directors of special ed or the nurse running this program. Whomever in your district is running this program, it is vital that you keep a clear line of communication about how you're moving funds on people that you're paying. So please, if you are working with these people, please have a monthly meeting just to ensure that if you move people off money, it's not going to negatively impact the school-based Medicaid program. It can take 5 minutes, but just review the staff that they are responsible for. It is so beneficial in catching these claiming of federal funds. And then another huge finding is missing a parental consent and not having something listed in the IEP that they're claiming for, or not having a current evaluation. But parental consent and federal funds are definitely our top findings. So these are some great ways for your district to try to increase your Medicaid reimbursement. Always check that your practitioners aren't 100% federally funded. This is the number one way. When we talk about school districts paying back in your cost settlement, it's typically when we finally figure out what the error is, it's was claiming somebody incorrectly. Somebody didn't communicate and they did claim them 100% federally funds, and the director of special ed did not know, and that's a great way to increase that reimbursement. If you are claiming them, just pull them off the list. You won't end up having to pay as much money back. Review practitioners and health aid lists and make sure that they correlate with your random moment time study. So in order to direct bill for these providers, there is a KDE annual application that these people have to be listed on. These providers must be listed on. In order to be able to list those people, they must be on one of those lists in the PCG staff pool list. So they have to be on at least 1 quarter. That's a huge finding that we find oftentimes. So make sure that your direct service annual application, that person is listed on your staff pool list. Don't change employees' funding without working with the director of special ed or the Medicaid liaison. Attend Fairbanks trainings and PCG trainings. There are oftentimes updates on these trainings. Fairbanks trainings happen once annually. They're about an hour long. If you may know it really, really well, but there may be something that has changed. So please go to those trainings. PCG does a refresher every quarter, and oftentimes at the end of these, they have an open answer and question, time frame. So it's a great time where people ask questions, and it may be something that you're not aware of, but somebody may ask something, and just hearing it, and then you might question, is my district doing that? Am I doing that right? It's a great way just to double check yourself. Keep all munis reports for each quarter. Whatever munis report you run, when you enter those numbers, please keep that original munis report, because when we run them at a later time, it does not show the exact numbers. The numbers never align. So keep a hard copy of those munis reports. And please be timely for those PCG deadlines. When we are closing a quarter for PCG, if you are not closing out your quarter and checking your finances and signing off on them, you are holding up all the districts. This means it takes longer for them to close out the quarter. This means it takes longer for them to pull those numbers, which in return means that when KDE data, like we have to request a data request for this. When we request it, it's delayed, and then it's delayed getting the payment to you. It is vital that you meet deadlines because you're holding up the whole state. It's not just one person. It's not just PCG you're holding up the whole entire state's claim. So please be cognizant of that. This is the contact information for the Department of Education. Cecilia Van Dyke is the main contact. I am part-time at KDE, so if you ever need anything, you can always reach out to me. But you can always catch Cecilia full-time at KDE. Annette Newsom is our contact at the Department of Medicaid. I've also attached Fairbank's contact information if you want to make sure that you're on their mailing list, or you want to make sure that you have an account with them. This is where you can email and get that information. Lastly, we've included Public Consulting Group's contact information. Public Consulting Group has a Zendesk, so you can ask them questions anytime, and they have a help desk that you can call or email or chat with. And so that's pretty helpful. If you're inside their system and you have a question, there's a chat bot at the bottom of it, and you can ask the chat bot and it'll know exactly where you're at in the system and help you walk through that process. So if you're not sure if you have a login to Fairbanks or PCG, this is who you can email and they will get you set up. And then lastly, these are the KDE Medicaid websites. This will take you to our technical assistance guide. This is a great place to check on if the practitioner is what license they need. This has all the most current requirements from Department of Medicaid, which automatically comes from the CMS. So if you have any questions about a specific thing, this is where you are going to want to check for direct billing. And then if you have any questions about the administrative claiming and you want guidance on that, you can reach out to us, PCG, or you can reference this assistance guide for the SBAC, and it is very helpful as well when you're making those cost pool lists. This is a great thing to reference. Any other questions? We would be grateful for you to email us. You can email me, or you can create a list with Tim if that is what you all want to do. However you want to compile your questions for this training, I would encourage you to ask anything you want to know because we are happy to answer that. This program is very overwhelming. There's a lot to consume, but it is very beneficial to the school districts. But there are a lot of gray areas and there are also a lot of rules. So if you kind of want to question something, please don't hesitate to reach out. That is what we are here for. And I know it can be kind of boring, but it does bring quite a bit of revenue to our school district. So please don't hesitate to reach out. And if you have some questions that you really want to work with some excellent finance officers, I know a bunch of finance officers that are masters of the school-based Medicaid program. So if you'd like to reach out to find out who those people are, I'm happy to connect you. Thank you all so much for your time, and please don't hesitate to email any questions you have again. And thank you for hearing me out today. Have a good one. Thank you. Bye.